Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello, and thank you for joining the Axxess Hospice On-Demand training webinar for skilled nursing visit documentation. In this webinar, we will review the different visits that the nurses would do on a routine basis in Axxess Hospice. This includes the skilled nurse visit, the skilled nurse PRN visit, the skilled nurse telehealth note, the RN recertification assessment, and the hospice aid and LPN, LVN supervisory notes. We're going to begin with the most frequently used document, which is the skilled nurse visit. The skilled nurse visit can be done by either an RN or an LPN. Let me close some of these extra buttons I have here. When you open a skilled nurse visit or any other document for clinical documentation, open the plan of care profile so that you can be reviewing the problems, goals, and interventions that are listed for the patient. It will open in a new tab from your visit so you can easily go between them. Expand all so you can see all of the problems. Look for anything related to the skilled nurse, as those are the ones that you are responsible for doing something about at your visits. To review updating the plan of care during your visit, please view the IDG Preparation for Clinicians webinar. As in all of our documents, start by entering your visit time in and your visit time out at the end of your visit. Documentation time is for any time documenting outside of the patient's visit, at the bedside, or either in your car before going to the next visit. This would be for any time that you're documenting in the patient's, in your office, or perhaps at your home. You'll always see the attending physician and the list of diagnoses for the patient. Your vital signs and additional measurements are just like in your admission assessment. It's best practice to put your eligibility documentation, such as your mid-arm circumference, your height and weight, and your BMI on each of your visits. To calculate your BMI, select the link in the tooltip, which will take you to a BMI calculator. My patient is 172 pounds and 5'5". Which is a BMI of 28.6. Your FAST, your New York Heart Association. If you're not sure how to complete these, use the tooltips to assist you. Same with the KPS and PPS. There are tooltips that will help you with scoring these if you are unfamiliar with the documents, and there are links that will take you to further information. All of your nursing documents will start with an imminence of death and higher level of care assessments. If your patient might be having signs of imminence of death, please document them here. If the patient dies during a nursing visit, there is a link to open the death note inside of the imminence of death section. Please document all time for care that you provided while the patient was alive on the visit note and anything from the time of death onward on the death note. The assessment for higher level of care shows what Medicare lists as criteria for general inpatient care or continuous care. You also have the option for other based on your physician's judgment and documentation of the need for the higher levels of care. In your documentation narrative for the higher levels of care, there is a tooltip that helps you with documenting what your Medicare administrative contractors, otherwise known as MACs, will be looking for when they review your patients at higher level of care. Next, we have your different symptom assessments. Hours of sleep per day does flow to your IDG summary. And anything with a colon at the end, when you select it, will have more options inside. If you select no problems identified, everything beneath that will collapse, but you will still have a comment section. You can document your fall risk assessment and Braden score as often as your organizational policy dictates. Your fall risk assessment score and your Braden scale score will flow to your IDG summary as well to help indicate signs of decline. If your patient has wounds, select the Wound Worksheet button to open the new section for wound documentation. Once you add information on one wound, you will be able to add additional wounds. If you accidentally hit the extra wound, just select delete and that will close that up. Please make sure to use the tooltips inside of the wound measurements to ensure all of the clinicians are documenting the wound assessment in the same way. The pain assessment is similar to your admission assessment without the HIS questions. If your patient is verbal, you will use the yes or no. And if they are unable to tell you about their pain, you can choose to use the Wong-Baker or FACES scale, or you can use the Pain AD or Pain Assessment and Advanced Dementia scale. In all of the nursing visits after the admission, you have the symptom rating scale that's based off of the Edmonton System Assessment Scale, otherwise known as the ESAS. The ESAS requires that the patient or their caregiver is able to give you a rating of the amount of distress that they are having from each of the symptoms. They are color coded. So as you see the higher numbers, you will see the red and orange scales and yellow in the middle. If you start seeing numbers that are getting higher in here, you might want to consider making changes to the plan of care. The plan of care review should be documented at each visit that you've reviewed the plan of care with the patient, and if any updates need to be made, you update them with the input from the patient and caregiver and facility staff as indicated. If you change your plan of care, you will need to make sure that you educate the patient, caregiver, and facility staff on their responsibilities related to the plan of care. The blue buttons are present to be able to add a new physician's order document for things like level of care, diet, or in frequencies, DME, or supplies. You can add the physician order document and make the changes. If you need to update the advanced directives or emergency preparedness for the patient, selecting these blue buttons will take you to that part of the patient profile for you to make the updates. Coordination of care being a top 10 survey deficiency pretty much every year is important to document at each visit for all disciplines. Any communication you do with any of the people inside of here counts as coordination of care. So if you are working with the patient and the caregiver, and perhaps you call the physician, document that as coordination of care. If you call for medications or supplies or DME, that's also considered coordination of care. And in the coordination of care is the incident report. To view how to do the incident report, please view the additional clinical documentation webinar. In your medication section, please always take note of your medication issues identified, as this is a top 10 survey deficiency for many years in a row as well, to ensure that you're assessing for the presence or absence of the medication issues. To view or change your medications during a visit, select the Review Medication Profile button, where it will load the medication profile for the patient in a new tab. This is helpful for education as well as making any changes. Let's come back down where we were. There is an infection control section in all of your nursing documents. If you have a new infection suspected or diagnosed, you would document that here. And you can document your infection report if you have signs of a new infection. Please view the infection report and infection log webinar for instructions on how to do that. And for entering infectious disease profile, please view the additional clinical documentation webinar. Your interventions performed this visit should be done with a review from the interventions on your plan of care to show that you are following the plan of care during your visit, which is a regular top 10 survey deficiency. You can also summarize in free text. In your progress toward goals section, which we will review more in the IDG preparation for clinicians webinar, you'll look at your goals that you have for your patient and document on the progress for the goals. So we said this patient has pain of 0 in this visit. So we're going to say the progress toward goals for this is patient reports pain at 0 out of 10. Continue goal because it's working. If you do not make any changes to the plan of care during your visit, you can select current plan of care effective for symptom management. Remember, changes to the plan of care include new medications, frequencies, DME, level of care, problems, goals, and interventions, diet, or activity. To have this section of your document go to the IDG summary as your IDG note, select the button Send Note to IDG Summary. This will send your Progress Towards Goals section to the IDG Summary. Then you have your narrative note, and note that there is a tooltip here. The tooltip will help you with documenting if you're doing visits for general inpatient, continuous care, or respite care. These are recommendations from Medicare on the types of things to document to ensure that you are having backup documentation for the patient's higher level of care. Also in the narrative note, we have instructional text saying to address any changes to physical, psychosocial, functional, emotional, or spiritual needs. Paint the picture of the patient's condition and reason for continued care. As you've probably heard from your organizational leadership, each note should stand alone, and you would be able to look at this document and understand that the patient is eligible for hospice services. All clinical notes have the option to have a template added in your narrative note section. Based on your organizational policies and your permissions, you may be able to add your own templates to your organizational template list, or your clinical leadership may have written templates of what they want to have in your clinical notes. The final section of your nursing visits is the ability to add a supervisory visit for your hospice aide, LPN or LVN, or homemaker. Most organizations do choose to place these on the schedule for the clinicians every 7 to 14 days to ensure that these are not missed, as not having your hospice aide supervisory note done every 14 days is a regular top 10 survey deficiency across the country. But sometimes during your visit, there are things that are said that make you also know that you need to do an extra supervisory note. You can do that by clicking the buttons based on the discipline you need to do the supervisory note on. All of the supervisory visits have the same content with a different title based on who is being supervised. Enter the name of the person that's being supervised, and then select all that apply. The specific language inside the supervisory notes is dictated from Medicare of what they want to be evaluated in a supervisory note. Please note that the top 7 are things that show that everything is fine and no additional actions need to be taken. Changes made to patient plan of care means that you would need to do a new hospice aid plan of care or care plan to change the assignment for your hospice aid. So if you select this option, please make sure to go in and add a new hospice aid care plan to make changes to the care plan. Deficiency in aid services identified and competency evaluation required requires you to call your clinical leadership, because if this so if you feel that this is something that may need to be selected, please contact your leadership at your organization to discuss this and make sure that you have a plan. You also can then document any additional information in your supervisory note here. When you are done, select complete, and you will be able to sign your note the same as you do for any other note in Axxess Hospice. And if you are a JACO certified organization, you will also be entering the time. Once you have completed your skilled nursing visit, just like any other visit, select complete. It's telling me that I did not put a visit time out, which is required to complete my documentation. Now, when I select complete, I can complete my documentation. I will then close my plan of care. The skilled nurse PRN visit is very similar to the routine visit, so we will not spend much time on it. Again, open your plan of care profile when you start any visit. You will see that one of the differences is there is a section called Assessment Details where you will write the reason for your PRN visit. You would document your vitals and additional measurements as indicated. Best practice would also indicate that you would say if the patient requires a higher level of care from the changes you're seeing or if the patient is imminent. You will see the other change in the PRN visit from the routine visit note in that you have the option to say not assessed this visit on all of your symptom assessments, where you can focus then on the reason for your PRN visit. The rest of the document is the same as your routine nursing visit. The skilled nurse telehealth note also has the plan of care profile button that you should open at the beginning of your visit. This note is a combination of your skilled nursing visit and your care coordination note. So you'll be able to say that this was a telephone contact and who it was that you talked to. You may have the ability to get your vital signs and additional measurements from some of your patients on a telehealth visit. Your symptom rating is here so that you can ask questions about any specific areas that might be causing the patient distress. You also have a section to determine immediate care and support needs. Based on your discussion on the telehealth visit, you might note that the patient is having increased physical symptoms, psychosocial symptoms, spiritual or existential symptoms, or bereavement needs that might require immediate intervention and support from either you or a different member of your interdisciplinary group. Your interventions performed this visit and progress toward goals are the same as on your clinical documentation for your routine and PRN visit. Please note that CMS is requiring that any goals that you are working on using telehealth are indicated on your plan of care, stating as an intervention that this is a goal that is being addressed via telehealth. In your narrative section, you will say who it was that you got the information from on the telehealth visit. Also in your narrative, CMS is requiring for your telehealth note for clinicians to document why they are doing a telehealth visit. They're requiring also that you say what type of device you used for your telehealth visit and what program you used, in addition to the rest of your narrative. You can document that you have received consent for your telehealth visit and that you reviewed your plan of care or updated your plan of care during your telehealth visit. If the need for an in-person visit is identified, you can select that here and say why you feel that an in-person visit is necessary. You have buttons in here as well to add changes to the physician order, advanced directives, emergency preparedness, or also to update the infectious disease profile, as well as the different supervisory visit notes. When you are done with your telehealth note, you select Complete and complete your document like any other document inside of Axxess Hospice. Of course, always putting your visit time in and out. The final visit we're going to review inside of the routine visits that nurses will do is your recertification assessment. The recertification assessment is the one visit that does need to be done by a registered nurse and not an LPN or LVN. Much of the recertification visit is the same as the nursing visits that are routine in PRN with some very slight differences. So I'm going to focus on the differences in here and not the similarities. The vital signs and additional measurements, imminence of death. There is a slight difference in the layout, but the content for all of your symptom assessments is going to be the same. It is recommended on your recertification that you should do your fall risk assessment as well as your Braden scale, since those will flow over to your IDG summary and help you with being able to identify decline during the benefit period. Your symptom rating scale is here as well, as is your pain assessment. So the difference in your recertification visit is here in your plan of care review section. In here, you will see that you will have the order to continue care, enter the patient's primary diagnosis, which you can have as a reminder up here in the top of the patient chart. So this patient has esophageal cancer as the primary diagnosis. If you have additional orders for your recertification, you can enter them here. If your jurisdiction requires an order for nurses to do pronouncing of death, please enter that here. Update your diet, your activity, and your level of care, which is required. Your higher level of care assessment is in this section instead of at the top. You can update your frequencies from here, and you'll be taken to the patient's frequency profile. You can see that unlike in a regular routine visit where you have to attach this to an order, this will automatically be attached to your recertification assessment and be populated on your recertification plan of care. So you'll add your visit frequencies and select your benefit period. On a recertification, do not select your current benefit period, although if you need to change that as well, you can. But you're going to be entering your frequencies for your next benefit period. The start date for the order will be no sooner than the first day of the benefit period that you are assigning these visit frequencies to. Again, count your weeks to make for your weekly frequencies and your months for your monthly frequencies. This is a 90-day benefit period. So we're going to start with this first week being week 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, and then this last week is only 1 day. So I'm going to go for a 13-week. And I'm going to use a range of 1 to 2 a week for 13 weeks. And of course, selecting my discipline as the skilled nurse. I'm going to add a PRN order in here as well. If your agency has a policy of using a template for the reasons for PRN, please search for your template by entering the information in here. You'll be able to see your frequencies for your next benefit period are showing up in here. To return to the assessment, select the Return to Assessment button. And if I refresh, my frequencies will come and pull over to the assessment. And there they are. Here's where I will review my plan of care. And if I make any updates, I can document that I did education on the updates to the plan of care. Now you can see I have a few additional buttons down here. As always, I have my emergency preparedness and advanced directives. If my organizational policy is that I'm going to add a new hospice aid plan of care at Recert, I can place one on the schedule here. If I need to change my supplies or DME, I can use the buttons here and it will take me to the patient's profile. And unlike during a regular visit or outside of a visit where I have to attach the changes to my DME and supplies to a new physician order, you'll see that these updates will be added to the recertification assessment. And then I will save my changes and return to the assessment. If I need to review and update my plan of care, notice I did not have the review plan of care profile button at the top of this document. It is here in your plan of care review section on your recertification, where you will see that again, this is not needing a plan of care order because these orders will go on your recertification assessment and populate to your recertification plan of care. So I can come in and make my updates to the plan of care and add new problems. When I'm done, I can return to the assessment and my changes will be placed on the assessment. Coordination of care, medications, and infection control should be documented as usual. And if I need to review my medication profile and add new medications, I can do that here and they will come onto the medication profile and to the patient's recertification plan of care for signature. My interventions performed this visit and progress toward goals are the same as my other visits. My narrative note on my recertification assessment also has the ability to be sent to the IDG summary, and the narrative will flow to the recertification plan of care. If your organizational policy is to use the clinical evaluation and LCD visit along with your recertification. Usually that will be placed on the schedule for the clinician, or in some cases, they may ask you to just use the button to open that. For more information on the Clinical Evaluation LCD document, as well as the Hospice Aid Plan of Care, please view the webinar for additional admission documentation. When you are done with your assessment, select Complete, and you will complete your your recertification assessment in the same way you complete all of your documents. So for more details on how to document care coordination notes, missed visits, incident reports, addendums to completed documents, please view the Additional Clinical Documents webinar. To review how to update your medication profile, please view the webinar from the Hospice Admission on Medication Profile, as we also go over making changes. To do more detailed adding and updating visit frequencies, view the webinar on frequencies as part of the admission webinars, and also the IDG Preparation for Clinicians webinar. In summary, in this webinar today, we reviewed the routine visits that a nurse will do, including the skilled nurse visit, the skilled nurse PRN visit, the skilled nurse telehealth visit, the RN recertification assessment, and supervisory visits.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.